Hi everyone, Lynette Burt here from HardyGroup Search and Recruitment. Lovely to have you joining us today. It's my great pleasure to be introducing you today to Katrina Seng, who is the Regional Director of Nursing and Midwifery at Fleurieu in Western Australia. I would like to just start with a welcome to country. In the spirit of reconciliation, HardyGroup acknowledges the traditional owners of country throughout Australia and the connections to land, sea and community. We pay our respects to the elders past, present and emerging, and to all people today of Aboriginal and Torres Strait Islander peoples. Thank you, Katrina, for joining us. It's really nice to have you on board. For those of you who do not know Katrina, she is the Regional Director of Nursing and Midwifery at the WA Country Health Service, with over 20 years' experience in the healthcare industry. Katrina has held senior leadership positions in various organisations, including the Barossa Hills and Fleurieu on Kangaroo Island, as well as the Royal Flying Doctor Service of Australia. Nice to have you today, Katrina, and thank you for joining us.
Thanks, Lynette.
So Katrina, you have a real passion for primary healthcare, population and health, and working in rural communities, and that's really evident in the work that you've done in your career to date. I was wondering if you could share with us a little bit more about your experience working in rural remote communities and what it was that attracted you to this line of work.
Thanks, Lynette. I am a born and bred country girl. I was born in southeast Queensland out on the Western Downs and grew up there. So my affinity with country people has been my entire life. I was fortunate enough to do my graduate nursing position out in Longreach in central Queensland, and that placement really set the tone for my passion for rural and remote healthcare and the way in which teams work together. I was fortunate to rotate through Longreach, Winton, Blackall, Tambo and Barcaldine in my graduate year and had a beautiful experience in all those facilities where I was well supported and well loved and cared for by the teams there, as well as the communities being really open to having new people in town and getting to know those people. And so that early start in rural and remote and particularly working in close-knit communities was the start of my trajectory of really to spend the last 20 years working in rural and remote facilities across Australia now. So 3 states under my belt and some time with the Flying Doctors, which was a passion of mine growing up. And so I suppose the takeaway message is that try something different. You don't know what you will experience, and there's a chance that it could be, life affirming or life changing in the sense of changing your trajectory of where you'd like to go.
Excellent, thank you. So Katrina, could you tell me how you incorporate new technologies and innovations to tackle those challenges of working in rural remote areas, and how you've done that to improve patient outcomes?
So I am a huge advocate for telehealth. For those that live in the bush, there sometimes is a thought that coming into the city is a good thing and, being away from family and whatnot. And if you ask a majority of patients around, would you prefer to stay at home and see your specialist if appropriate, or would you like a trip into your metro setting? Most are going to choose to stay home. The onerous part of travel, of leaving home, of leaving loved ones to then attend to an appointment that, could potentially be facilitated through a telehealth or a video conferencing unit. A lot of patients are opting for this. So telehealth has come a long way in being able to support those, particularly in rural and remote areas, to be able to access world-class healthcare, but at the click of a button. And I think as we see the increase of our internet coverage in our spaces, we see the ability for those to be able to be well connected through internet and whatnot, and that our nurses and health professionals are able to utilise tools and skills to be able to support telehealth appointments, then we're seeing a real shift that rural and remote people have access to these specialists that might not necessarily visit their space. A good example was we facilitated a ENT clinic up in North Queensland where the specialist was in Canberra, and we had a digital otoscope, so looking in the ear, and so we would video conference looking at an ear with the specialist in Canberra, and these kids were able to have their specialist appointment, not leave the community, all done and dusted in 10 minutes with a nurse that they knew, and it worked seamlessly. So I'm thankful for those metro partners who work beautifully in that space. But also, I do find bush nurses are really keen to give something a crack and try something different that helps with the patient outcomes, that benefits the whole community.
Thank you, Katrina. Can I ask, Katrina, what's your long-term vision for the future of rural healthcare? How do you see it evolving?
I'd like to see it evolve in the sense of that it is an equal specialty, just like any other specialty. Rural and remote generalism is taking a hold not only in nursing and midwifery, but medicine and allied health, where we are starting to recognise that those that work in rural generalism or in a space where they need to use different skills across the lifespan have really valuable ways in which to share that skill set with our metro partners or our specialists. And so my long-term vision or hope is that as we continue to go forth, that rural generalism or rural and remote nursing and midwifery will be seen as an equal partner, as is, any other specialty in healthcare, i.e. orthopedics, ICU, ED. We find that rural and remote nurses have a very broad set of skills and can work to the top of their scope of practice in their facilities if they have the correct access to education and training to be able to get to that point.
Excellent. Just touching a little bit on workforce, because I think it's something that everyone is struggling with at the moment, and without a doubt, the rural and remote areas are really suffering. Can you talk to me about what sort of steps you're taking to address workforce shortages in the rural areas, and particularly in the Pilbara?
I think the main thing we need to be really considerate of is that COVID has changed the landscape for healthcare and, if not employment, internationally. And we need to be really cognizant of what that has meant. I think what I have seen over the last 3 to 4 years is a shift from this thought around I need to be in the space with the prettiest building or the most assets or the most equipment available or, the biggest, income generating elements. But I think what we're seeing now is that people are choosing culture. People are choosing to work with people that share their goals and their visions and their core values. And so I think we need to be really working towards the fact that people are choosing to go to certain places that have a good reputation. And it's coming back full circle, really, isn't it? That, if an organisation or a facility or a area has a really good reputation for not only supporting their staff and supporting their well-being, but also supporting a culture in which it has safety, at its core, then we see this word by mouth, vicarious recruitment drive happening because people are like, hey, come and work here. They're a great bunch of people. And most of the time I have found that when you have that adage going on, people are like, yep, absolutely. And they're willing to look over the not so pretty building or not so well resourced moment or whatnot, because the humans around them share their values, share their goals, and share their respect for the consumer and the patient in that journey.
And I think maybe, Katrina, too, that sense of community that you may not necessarily get in a large metropolitan area, whereas in rural and remote nursing, and that sense of community really plays an important part, doesn't it?
Absolutely. And many rural and remote nurses or health professionals really will talk about that that moment of, going to the shops and running into someone that you've helped, and them having a broad smile and a big hello for you, and that warm and fuzzy feeling of, my work does make a difference, and I'm seeing that outside of the four walls of my clinic or my hospital or my healthcare setting. And that is a real cup-filling moment for a lot of healthcare professionals, to see the full span of outcome and being able to be a part of that community and care for that community, because healthcare is caring. And so when you're able to apply that and see the outcomes of it, I think you are able to really work towards that holistic picture of caring for your community is more than just looking after the patient on your doorstep.
And just to wrap up, Katrina, thank you so much for your time. But obviously you've just relocated to the Pilbara, and HardyGroup are working with you on a number of recruitment roles. Could you just tell us a little bit about how you found moving to that region and what it is that you've come to love about it?
I love the heat, so that is a very big tick in my box. I have been incredibly pleasantly surprised by Port Hedland. Yes, it is a mining town. Let's not escape the economic background in that space. However, the community that wraps around that population that supports the ports is incredibly comforting and welcoming, and I do find the community to be really settled and calm, but also very giving. I have enrolled the 3 kids in school. We have joined sporting organisations, and I've had nothing but welcomes and hellos and can I help you? And that goes for work as well. I have moved away from family again, and I have had nothing but a supportive team in going, what do you need to make this space work for you? So it has been a big move, but I do find in most instances that those living in the bush are all in a similar situation. They're either living away from family or friends and whatnot, and so you create your own little micro community and support for one another. So it has been very pleasant thus far, and I'm really looking forward to working with the Pilbara team across the entire space of what our journey looks like over the next couple of years.
Lovely. Thank you so much, Katrina. I really appreciate your time today and look forward to working with you on filling those really important positions, which there'll be more information about in the newsletter. Thank you.
Thank you.